Hey guys, Sydney here in the AAFE Training Center. We have a lovely long-time patient here getting her regular neurotoxin treatment. So you can see here I'm marking the patient up. I'm having her raise her eyebrows really high, a surprise look, marking those lateral borders, and then getting good coverage of the entire muscle. Depending on the size of the forehead, I'll have more or less dots just to be sure that I'm really getting good coverage. I marked her glabella with 5 different sites, the procerus, and then each corrugator, both medial and lateral, to get that pull relaxed. Her crow's feet, I'm right outside of that orbital rim because I want to be sure to stay within the muscle. And then I'm also marking a brow lift right at that upper portion of the orbicularis oculi muscle to get that pull to relax a little bit and give the illusion, or the look rather, of a lifted brow. It can really kind of just help balance things out a bit, especially if a patient has some hooding. Marking masseters here, so I have the patient clench, mark anterior and posterior borders, and then I mark about 1 centimeter above the edge of the mandible, and you could see I'm definitely double checking those marks a couple times to be sure I'm right in the meat of that muscle. Here I am starting to inject, so I drew up my neurotoxin, and I am making it spread all the way across that muscle. So I have a little bit of neurotoxin for each of these different insertion sites. That's going to give the patient good coverage along that entire muscle. This muscle is very, very thin, but you can see it is a pretty big muscle along the entire forehead. Corrugators, procerus, I'm going straight in. Corrugators, I'm kind of supporting that orbital rim and making sure I'm right in the belly of that muscle, not too far in with my needle, because that frontalis muscle does run behind and we don't want to run into any issues. And again, really supporting that. You'll see here I'm holding it for just a couple seconds. Then that's more just for peace of mind. I really want that neurotoxin to stay where I injected. Orbicularis oculi, or crow's feet, you can see here very superficial. I'm holding that tissue taut and injecting up and away as we don't want any product to run down the cheek. Brow lift, very superficial. It is a spicy injection. You can see here the patient just blinks or winces just slightly. Nothing that's intolerable. I'm going towards the medial aspect of that brow, and I'm keeping it very, very superficial. Masseters, again, double checking my site, and I did split that injection up into 2 different injections. Depending on the patient's presentation, I'll either do 1 or 2 injection points all the way in, all the way to the hub to really get that neurotoxin to the belly of that muscle. And then temporalis, you can see I cleaned the area right before I injected because it is the hair, and I injected in 3 sites, anterior, medial, and posterior. This patient gets chronic migraines, clenches, grinds. And so this really, really helps. Here I'm seeing injecting that deep masseter. The deep masseter is another little belly of that masseter that's often missed or overworked if that superficial masseter is relaxed. So it's definitely an area that can help. Patients complain often of ear pain, and usually what it is their deep masseter just needs a little bit of treatment. Again, other side of that temporalis, treated with the same amount of neurotoxin, and now we're moving on to lip flip. I didn't mark this area, I did clean it. Very superficial, close to that vermilion border. There are a couple different ways to do this. I find that this technique on this patient works effectively. I do treat upper and lower, and that's because this is a sphincter muscle, so I want to have treatment all the way around, just a little bit in each of these sites. Thanks for stopping by. Join us next time and be sure to get AAFE certified today.